Hey guys, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today we're going to be talking about the situation where your doctor might have told you that you didn't have PCOS. I know it's a little bit complicated, and I know that sometimes feels frustrating when healthcare providers may be able to relay that message, because sometimes the way our body feels, it might be that we are consistent with PCOS. We're going to get into why that might be a little bit challenging of a diagnosis, and why it's sometimes hard for doctors to make that diagnosis too. So let's get to it. So if you like these videos, go ahead and like and subscribe. I'm going to be starting my telehealth practice pretty soon, so if you're interested about how you can check out my website, consciousgynecology.com, to look into some practice information. So that being said, yeah, PCOS, polycystic ovary syndrome. It is a really tough diagnosis, and so much that all of the organizational bodies out there that help us understand how to diagnose PCOS and come up with the criteria have a hard time. They argue with each other about what really meets a criteria, but by and large there is a set of 3 characteristics that are called the Rotterdam Criteria. And these criteria are, number 1, irregular periods, number 2, hirsutism, which means hair where you don't want it, and sometimes that could be hair on your chin, it could be hair on your midsection, thicker pubic hair that kind of goes down and runs down your legs. Sometimes people would include testosterone levels that would elevate your acne levels in your skin, that will increase acne. And sometimes the 3rd criteria is small little ovarian cysts on the ovaries that are visualized on ultrasound that don't necessarily mean that you need surgery to remove them. They're just that your little ovary is trying to ovulate, but they're not doing a good job at it. So 3 criteria, you must have 2 of the 3 features to meet the diagnostic criteria for polycystic ovarian syndrome. Now, there's nothing that says like you must have this for several months. It doesn't say that if you had it for 3 months and then it got better, that you don't meet criteria for PCOS. It just means that these are the physiologic clinical features that are consistent with polycystic ovarian syndrome, and depending on the time that you went to see your doctor will demonstrate when you have those features. And so maybe you were trying to get in to see the doctor for several months recently and your periods were irregular, and then the stress levels in your life improved, and then your periods became regular, and then you went to the doctor and they did some blood work that usually involves some sort of testosterone level, free and total testosterone level, maybe a hemoglobin A1C, maybe a follicle stimulating hormone, maybe a luteinizing hormone, and all those are normal. And if you have normal appearing ovaries and your periods have resolved and now are normal, well then, yes, your doctor is going to tell you you probably don't have PCOS, and that can be incredibly frustrating. But there are so many clinical features that demonstrate PCOS qualities to us doctors that aren't always cut and dry on the labs. And in fact, our major textbooks that actually teach us how to diagnose these things say that we should not rely on solely the laboratory features alone to diagnose PCOS, that many times women have clinical features of extra hair where they don't want it, hair on their chin, thickening on the neck here of like this dark patches and skin tags on the neck. That actually demonstrates a really high level of insulin resistance, that actually your body's creating insulin growth factor antibodies to areas on your skin that start to develop these dark patches of inflammation. That is really high level insulin resistance that is also related to androgen sensitivity, that has to do with excess androgens from your ovaries, but also your adrenal glands. Sometimes those levels are not things that we can test for on the regular free and total testosterone labs. And in fact, so many androgen levels that come from our adrenal glands are actually not really measurable in the typical free and total testosterone levels, and so can be very misleading. So doctors do have a good place in their heart when they measure these levels, and when people come in with extra hair where they don't want it. It comes from a good place in their heart because we want to make sure that we're not missing like an androgen secreting tumor where the testosterone levels are very elevated in the hundreds and hundreds. But when they're not that, or they're normal, then sometimes we can mislabel patients and say, no, you don't have PCOS because your testosterone level isn't elevated. But it's a clinical feature. That's really important to understand. And that our periods are irregular depending on what's going on, depending on our insulin levels. So if you have had that frustration that maybe a provider told you that you didn't have PCOS, well, it comes and goes, and it's not always laboratory evaluated. Sometimes it's a clinical feature. So I'm here to tell you that you might actually do have PCOS if you have some of these features that we've talked about in the Rotterdam Criteria. Let me know in the comments. Tell me what you think. Does this sound right to you? Does this sound like something you've experienced? And maybe we can be armed with more information to help both ourselves and other women really understand what PCOS is all about. Well, if you like this video, go ahead and share it, subscribe it, follow my YouTube channel, Conscious Gynecologist, and also check out my new website, consciousgynecology.com. See you guys soon.